You're listening to Crashes, Claims, and Clarity, hosted by Darrell Burrow, a Georgia-based personal injury attorney with over 30 years of experience and founder of Burrow and Associates. With a background in both legal strategy and compassionate client care, Darrell has helped over 10,000 individuals and families navigate life after injury. Guided by his Christian faith and a deep sense of justice, he brings expert insight, personal stories, and powerful interviews to every episode. If you're looking for truth, support, and clarity in the aftermath of an accident, this is your place. This is Crashes, Claims, and Clarity.
Well, hello, everybody, and welcome to another episode of Crashes, Claims, and Clarity. I am your host, Darrell Burrow. I'm an attorney here in the state of Georgia. I'm the founder and owner of Burrow and Associates. We're headquartered here in Duluth, Georgia, although able to practice throughout the entire state of Georgia. Today, I'm delighted to be joined by Gage Winkels. He's a doctor of chiropractic at Health-Fit Chiropractic and Sports Recovery. He focuses on evidence-based care for musculoskeletal injuries with an emphasis on active individuals and performance-driven recovery. His work blends hands-on treatment, movement assessment, and advanced therapies like soft tissue work and shockwave therapy to help patients not just feel better, but function better. He brings a strong focus on skill, repetition, and precision in treatment. Treating recovery is something that should be trained and not just managed. Well, thank you so much, Dr. Winkels, for joining me today. How's everything?
Good. Yeah. Thanks for having me on. I appreciate it. Everything down here in South Florida is good. It's starting to get hot this time of year. So getting ready for summer.
It probably stays hot down there.
It does. It does. We had a couple cooler days in January there, but nothing compared to the rest of the country. So
Yep, understood. Well, again, thank you so much for joining me. Tell us a little bit about your background to start with.
yeah. So again, my name's Dr. Gage Winkels. I'm a doctor of chiropractic. I come from northern Minnesota, actually, a small town way up about 3.5 hours north of Minneapolis there. I grew up there and spent my, childhood there. And then I went to Minnesota State, which is in southern Minnesota, and I got my bachelor's of science there. And then I attended Northwestern Health Sciences University right in Minneapolis there for my doctorate of chiropractic then. So shortly after graduating, I said enough with winter and the cold temps and left Minnesota and moved down to South Florida here, and then have been in practice for a couple of years now down here in Boca Raton, Florida.
Oh. And much nicer weather-wise and probably a few other areas too.
Yeah, you bet. You bet. It's not a bad winter down here, that's for sure.
Okay. Well, today we want to kind of focus on, recovery, full recovery versus actually true function. Recovery, maybe when a patient is telling you they're feeling better, but different. So let's kind of launch into these questions. When do you actually know that a person might be ready to return to normal activity?
Yeah, that's a great question there to start off. I think the biggest thing is we need to understand that there is a difference between symptoms, oftentimes pain, and function. And so, from my standpoint here, I love to see symptoms reduce, whether that's pain or stiffness felt or tight muscles, whatever it may be present. But I really need to clinically audit function on that patient. So, how is that patient going through their activities of daily living? How are they getting through the workday if they've returned to work? How are they handling, some of the busier days where maybe they have to run some errands, they have a long day at work, they had poor sleep the night before? How are they functioning at that point? Not just how is their pain felt during that day. And so a really big thing on the clinician side of this is having sound clinical audits with how the body's moving and biomechanics, and then making sure that you're seeing some functional change with how the body's responding to treatment there.
Okay. And what advice or how do you prevent people who say they're feeling fine, but they are susceptible to re-injury of that same area? I mean, what do you tell them, or how do you try to prevent that from happening?
Yeah, another good one there. We have a saying in the office that a mentor of mine has taught me, and he calls it the terrible twos. So that's too much, too soon, and too fast. And so we'll often talk with that about patients is, look, I'm glad that your pain has decreased here, and I want to get you back into that fitness class or that yoga class just as bad as you want to get back there. However, if we jump back into that and we hit that fitness class 5 times this week in a row, that's going to run us into those terrible twos. And so we need to make sure that we have a plan of action in place to audit not only how the body's responding to an increase in, strain and stress throughout the day, but how some of those functional audits are in the treatment room as well, whether that's biomechanics or soft tissue or joint mechanics. We need to assess all of that and truly make sure that the body's prepared to take on a full day's load of strain and stress.
Okay, good, good. As far as the modality or the technique of adjustments, I think most people know, okay, that has to be a trained skill. But tell us what goes into that training, and how does someone starting out as a new chiropractor, I mean, how do they sort of find their way to become someone that's not just skilled at it because it takes skill, but someone who's actually an expert?
Yeah, I like to talk with interns at the office, with students at schools around the country. And a big thing is, adjusting is a sport. It's an athletic event. Okay. And so that's something where whether it's your first time swinging the baseball bat, first time shooting a basketball into the hoop, it's something you need to practice through repetition, and adjustments are the same exact way, right? To properly manipulate a joint and achieve your desired outcome, it takes repetition. And that's in school, that's in, extracurricular clubs at the various universities around the country. That's getting into practice and getting repetitions with people and working on that craft just as you would, practicing your golf swing or your baseball swing, shooting that basketball into the hoop. And it's really important to
Or
understand
trying
that.
or trying cases.
Exactly, right? In your world with the legal aspect, right? It's not going through law school and then you graduate and then, okay, here's your first time trying a case. Good luck, right? Like you have gone through that repetition with colleagues and through schooling, and it's a skill that you have to work and always strive to get better at. And I think that's so important for chiropractors is to be, the best that they can be and always be striving to improve with how they can deliver that joint manipulation.
We talked a little bit about people maybe feeling better, and you gave an example of someone going back to a fitness class of one kind or another. But those people that feel better and they may want to quit their treatment too early, and you're having a conversation and they say, well, I'm not going to the gym, but what do you advise or what do you tell them? Because sometimes it's just bending over to tie a shoe or something like that. What do you try to tell those people?
Yeah, that's the matter of the fact of it is it's not always going to be that person who, is hitting CrossFit classes or anything crazy throughout the week. Sometimes it's getting through those activities of daily living and just being able to do that pain-free. Unfortunately, it's something that we do see happen, with cases here is Patients will start to see some symptoms decrease or maybe symptoms change. You know, it was their left side on the low back and now it's more out into the hip, or now it's more down the leg, but the low back isn't as bothersome. And they might assume then that the low back is fixed, that there's no longer an
Mm-hmm.
issue there. Yet getting socks on is the worst part of their day, having to bend over and do that in the morning. And so, like I said, is we really need to audit those activities of daily living and make sure that we're progressing through, difficulty of tasks throughout our day, which for every patient, that's going to be different. For some, that might be the hardest thing they do is cleaning the house and doing some household chores. And then on the other end, you have, people who, yeah, are going to be trying to get back to fitness classes or whatever it is they do. And so it's really important that we audit that function as we go through and make sure that we aren't, as a clinician, releasing that patient from care too early,
Right.
where they run a high risk of re-injury, and doing a great job with patient education on, look, I'm so happy that your low back is feeling better, but we still have some signs and symptoms that function hasn't improved in the low back, in the hip. And so let's continue to work towards that to achieve your goals going forward.
Okay. And you mentioned audit the function.
Mm-hmm.
Is that done through a series of tests that you do? Talk with me a little bit about that.
Yeah, absolutely. So, in the treatment room with myself, and I think with the majority of clinicians, is we're running, audits on the body. For some clinicians, that might be just how joints and biomechanics of joints are working, and maybe they just adjust for that. For myself in practice, that's considering how joints are moving and the joint biomechanics. It's how is the soft tissues in the area? Muscles feeling tight? Do you feel knots or trigger points, adhesion within the muscle? And then movement screening as well, where a
Okay.
patient may, feel better with their shoulder pain when they reach overhead. However, you can tell that that's because they're kind of cheating that shoulder complex and using a lot more of their cervical spine or thoracic spine. And I tell you what, the body is brilliant in how it can make up for, lack of motion or lack of proper mechanics in places. And so you need to make sure you take a global approach to that and assess, yeah, not just how a joint is moving in a specific spot, but how is an entire region moving, whether it's through movement screens, soft tissue, joint manipulation, everything like that.
I would imagine that you're probably from the minute you lay your eyes on the patient for the day, you're going through pleasantries, how was yesterday? How's the weather? Uh, but you're actually observing them as they make every movement to go from your waiting area, your reception area, on back to an office.
That's 100% correct. And we're taught in school that, the treatment process begins when that patient essentially gets up off the waiting room or gets back into the treatment room. That's when that treatment process begins. And so as soon as a patient is getting up out of the chair in the waiting room, I'm assessing how's the low back complex moving, how are the hips moving, if they have lower leg extremities, stuff like that. How are we moving through there? And of course, going through pleasantries and catching up about how the weekend went and taking a subjective, we call it, and assessing how their symptoms are. But that
Mhm.
entire time, I'm also collecting objective data as well. And that helps paint the picture for what tools you have in your tool belt to really help that patient that day.
Sure. We mentioned in the intro that you have incorporated some shockwave therapy. Please tell us, what is that? What does that do? What is that to accomplish?
Yeah, so shockwave therapy is an emerging form of treatment in the musculoskeletal world. It is becoming more and more apparent across chiropractic clinics, PT clinics, even podiatry, orthopedists, right? It's spanning everywhere in musculoskeletal care. Essentially, what shockwave therapy is, it's a non-invasive, non-surgical form of treatment in which you utilize a high energy sound wave to stimulate healing on either, injured tissue or maybe chronic pain or stubborn injuries that you're just having a tough time getting true medical improvement on or breaking through that plateau. And so with it, it essentially uses this high energy sound wave to stimulate the body's natural healing response. There's a lot of great research out there for a variety of conditions on it. And that research will show that, physiologically, you're going to see an increase in blood flow to the area and a process called angiogenesis, or actually working on how that blood is distributed and through the vascular networks. Helps stimulate tissue repair and different biomarkers throughout the blood that help, upregulate tissue repair. It can help, mobilize any scar tissue that's in the area and help with management of that. Scar tissue, when it builds up, it's like super glue in on an area, and it can really restrict motion. So Shockwave does a great job treating that. And then,
Okay.
of course, there'll be a pain reduction with it as well, which is one of the greatest things patients love after a traumatic injury or something like a motor vehicle accident is they might be in a lot of pain. And if we can start to reduce that and speed up the healing and recovery time, it's a phenomenal tool to use
Hmm.
clinically.
Okay. And we've talked about people maybe wanting to stop treatment in the middle or missing appointments. They think they feel better. Is there a point where someone may have just simply waited too long, or I don't know that that would be the case, but after a injury from a car accident or a sports related injury, where they've just simply waited too long and there's irreversible damage?
Yeah, as a healthcare provider myself, my biased philosophy is you can always do something to help someone, okay? However, having that patient come in with, low back pain that's been going on for 5 years or even a year is different than the patient who was out on the golf course or cleaning the garage over the weekend, felt some pain in the low back, and then came in. And so that's where, as a clinician, you need to do a sound job setting expectations with that patient, and understanding that treating chronic pain can be different than treating subacute or acute pain, where we classify it
Okay.
as. But I would argue that, there's always something you can do to help someone. And, that might be something where it's you're not the person for it right then and there, right? Like if someone comes in and it's a really chronic case and you can't even help that patient get down on the table or something, maybe that's where you say, I'd love to work with you. Let's get you referred to someone who can help with this immediately, whether that's
Okay.
pharmaceuticals or, another opinion on the case. And then once you come back to the office and we've calmed down that, debilitating muscle spasm or the symptoms that patient is experiencing, then we can get to work and have a true return to recovery style
Hmm.
of care.
Yeah, that's good. That's good.
Yeah.
What do you say to the person that comes in and they've got low back pain, but yet you're starting to examine the whole body and you're starting to adjust and manipulate upper back, neck. I bet you get a lot of questions as to, hey, what's going on? My pain is in my low back.
Yeah, absolutely. There is cases like that come in every week. And it's something where, again, as a clinician, you need to do a good job, educating your patients and explaining why you're doing things. A common one with the low back is like after a motor vehicle accident, I will often find patients who have something like acute low back pain. However, when we, start to test through the thoracic spine or the cervical spine,
Hmm.
that will replicate their pain in their low back, right? Because we have ligaments along the spine, we have musculature that extends the length of the spine. And so a lot of times it is educating that patient properly on saying, look, I understand that the low back is really bothersome here. Let's take a global approach to this to make sure we aren't missing anything else as well. But this is why I'm treating in region A here to affect region B.
Mm-hmm.
And a lot of times too, depending on the severity of case presentation, sometimes that patient, disc herniation is present right after a motor vehicle accident or an acute injury. And you might have to just work above and below that region for a little bit until that disc herniation calms down, some of the symptoms calm down a little bit, and then you can start to approach the true root cause there. That's another thing I see in practice a lot. But again, I think the biggest thing is helping educate our patients on why we're doing what we're doing. And there's also some great resources out there in the world of soft tissue work where trigger point referrals. We have posters in our office that will show this where, you might feel pain over your right shoulder. However, when I press on that muscle in your cervical spine, you feel that pain in your right shoulder. So although the right shoulder is where we feel symptoms, we know that true source is in the cervical spine. And so that's something I'll always point out to patients as well is referral patterns from different, whether it be joint dysfunction or soft tissue dysfunction.
Yeah. It seems like education of the patient is a big part of your practice. I'm sure that would be one thing that would separate sort of an average clinician from the great ones that excel. What are some of the other things you think separate those two distinct levels?
Yeah, no, that is the truth there. I think, patient education is huge. I think, again, having a sound clinical audit process where we are going to be checking the joint biomechanics, the soft tissue mechanics, the movement analysis every time you come in, so I can understand that things are improving or aren't improving, and that we need to pivot and look, outside the box that we've created there. A huge thing as well is you cannot chase pain as a clinician, especially in the treatment room. Another great lesson I've had mentors teach me is if you chase pain in the treatment room, you will forever be lost on clinical cases because there is so many factors in a patient's case that can affect pain. And that can be from, radiating symptoms like what we were just talking about, or symptoms that travel all the way to in the world of pain science, we call it a biopsychosocial aspect, where
Hmm.
if a patient presents to your office and they just got broken up with or divorced and they just
Okay.
got fired from their job, their neck pain's probably going to be a little bit worse that day than on the days they come in and it's 75 and sunny and they got a raise at work and they got to leave work early, right? Like we've all been there. It's something where you get a little cold or the sniffles and all of a sudden everything starts to hurt a little bit worse, right? Your days feel a little bit longer
Yeah,
versus
we're
on the good days.
so impacted by stress and, as you mentioned, environmental factors. It's something.
100%. Diet as well, right? If you were out on the town all weekend and eating poor food and maybe consuming some alcohol in there, like your joints are probably going to feel that, come Monday morning when you
Okay.
present to the clinic. And so, yeah, it's patient education, it's taking a global approach care. And again, it's considering pain, absolutely, but also making sure that you stay sound functionally and with your clinical audits.
If someone, you've gotten them out of pain for the most part, but you're of course checking for function, and you go a period of time and that doesn't improve. improve, what do you do at that? Or it's not progressing like you know it should or think it should. What do you do at that point?
Yeah, that's where the importance of a good re-examination process comes in
Okay.
from a clinician side of things is, if you've been working on that case, for a couple times, a couple visits a week for 3 to 4 weeks, and you really haven't seen the needle move, whether it be, with a clinical audit on the joints or the soft tissues or biomechanics, movement analysis, pick your poison there. If you haven't seen that improve, then a good re-examination can help you take a step back, right, and consider all things at play here. It's really important to understand that if things aren't progressing as you would expect, there's a reason for that, right? It's
Hmm.
not just that this is the one random case that patient A doesn't respond to like the other 10,000 do. It's something where you got to understand, okay, maybe, what could be a small chance that this is happening, but I just haven't considered that yet. Because then you might find that diamond in the rough where it's like, oh, okay, that's what is going on here. And again, this is really important is staying a global approach to that and having that mindset from the clinician side of things. That will help prevent you from getting down in the weeds and hyper focus in on just a specific area or something like that.
Yep. Yep. Fantastic. Well, listen, Dr. Winkles, thank you so much for joining me. It's been an education on being pain free, but maybe not considering that we're back to full functionality. And you brought that to the light, and it's so very important. Please tell us where people can find you as far as locations or.
Yeah, so again, it's Dr. Gage Winkels. I'm a chiropractor in Boca Raton, Florida. The clinic name is Health-Fit Chiropractic and Sports Recovery. The clinic location is in Boca Raton, Florida. We are at 2900 North Military Trail, Suite 220. That's right in
Okay.
Central Boca there. And then you can find us on Instagram. Our clinic handle is at HealthFit Chiro. We do a lot of educational posts on there, a lot of, at-home exercise and tools and tips to empower our patients to, treat themselves at home as well. And then my personal Instagram is dr.gage, Gage, Winkels, Winkels. And that's all lowercase there.
Okay. Great. Great. It's been very informative. I really appreciate it again. And thank you, folks, for joining us on another episode of Crashes, Claims, and Clarity. Until next time, goodbye.
You've been listening to Crashes, Claims, and Clarity with attorney Darrell Burrow, founder of Burrow & Associates and a trusted advocate for over 30 years. If today's episode helped bring clarity or hope after an accident, be sure to follow, subscribe, and leave a review. To connect with Darrell or learn more, visit legalatlanta.com. Join us next week for another honest, faith-centered conversation about recovery, rights, and moving forward after injury.